Let's take a look at Jimmy's story. What he's thinking and what's going through his head. He's having a difficult time at school. And now he thinks, my parents think I'm just looking for an excuse to get out of having to do my homework. So I'm simply not saying anything about this anymore. I know I'm not lazy or stupid, but sometimes I think that perhaps I am after all. Because I'm simply not getting all my homework done the way I want to. Help, right? We don't hear that often from our children. And kids, they don't want to be doing bad at school. They want to excel. They do not want to be coming home with D's and C's. They want to be coming home with high marks, and they want to be excelling. But the truth is, 80% of learning is visual, and less than 15% of children have gotten their eyes tested before they begin school. And this is a shame. This is a shame because these kids are struggling and they're misdiagnosed as having behavioral problems and learning difficulties. In fact, the Learning Disability Association of Canada describes learning disabilities. They refer to a number of disorders which may affect the acquisition, organization, retention, understanding, or use of verbal or non-verbal information. But guess what? What is the non-verbal information? That's vision, right? That is vision. That information is coming through our visual system. And why does vision even matter for learning? Well, visual skills drive reading, they drive comprehension and attention. And vision is critical for learning for our children and ourselves, because we should always be learning. And, my patients say all the time, oh, I see 20/20, I'm good. But 20/20 isn't everything, isn't vision. 20/20 is just acuity, and it measures the distance that you're able to see something small, not your ability to read or not your ability to learn. It's really beyond 20/20. 20/20, like I said, is just the clarity at a distance. But kids may still struggle with that, even the clarity, and we will discuss that later today. It could be, there's more than 20/20. There's reading, our tracking abilities, our eye teaming abilities, our eye focusing abilities. And in addition to that, after the information comes into our visual system, our visual processing abilities. So then we know what the child can see. I'm going to have a little experiment with everyone today. So I'm just going to grab a volunteer here. Do you want to put on these red and green glasses? Perfect. Good, good, good. So when you're looking straight there, what do you see?
One red dot, two green dots, one white dot.
That's great. You're very lucky. You have full binocularity there. Some children are seeing double. They see 5 dots, right? Because one of the lenses sees part of it and the other eye sees the other part. You're seeing double. Some children will ignore an eye. They'll only see 3 or only see 2. Why don't you close your left eye and tell me, how many do you see?
2.
And what color are they?
Red and white.
And close the other eye and tell me what you see.
2 green, 1 white.
Awesome. Well, this tells us our binocularity. Thank you.
Thank you.
Now, double vision can look like this. The thing is, when you're a child and you see double, you don't know that's not the right way to see the world. I've had so many patients where I prompt the child to see, do you ever see things, kind of 2 of them, where you see one clear one, one ghost one? They're like, yeah, all the time. And the parents are like, oh, what? I didn't know my child sees double, but the kid doesn't know that's double, and to tell the parents, hey, mom, dad, I see double. So it could look like this, anything like that. It could look like a little double, more double, like a ghost. And this makes it really, really challenging to learn any information because you're seeing everything double. This is why reading can be so hard. You know, this is a great demonstration of when our eyes are working well together and aligned, you see single. When we have an eye churn or the eyes aren't teaming well together, that's when we can start seeing double. And this happens with children all the time. It doesn't have to be only with strabismus not aligned. This could happen post-concussion, post-accidents. Maybe at the end of the day when they're really, really tired and their eyes just are not teaming together, they can start seeing double. Now we have another aspect that we discussed with more than 20/20. It's the tracking. Now, eye tracking is so important. This could be a talk within its own. If we're doing eye tracking, we're doing smooth tracking, eye jumps, or fixations. We can see here is a great example of smooth pursuit being impaired. So the top, you could see all this jerkiness going on. And the bottom is not impaired, it's a little bit smoother. Now, if I have a tracking problem and I'm reading, I will not have enough energy or be able to process what I'm reading if the information coming into my visual system and into my brain is jagged. I'm seeing one word, then the next, then the next, then the next, and it's not in a line. Then processing that information is going to be really challenging. And you know, I only have so much energy during the day. If I have to spend 75% of my energy just to see, I have less to process. And that's when we have activities where we avoid something or ask my patient, do you like to read? Oh, I hate reading. Why? Why do you hate reading? Is it because when you're reading, you don't know what you're reading, you have to reread it all the time? Yeah, I just never find things interesting. Is it because you can't visualize what you're reading? Yeah. And this happens when we use up that energy to just get that information into our visual system. So you can see that it's more than just 20/20. There's a lot of pieces of the visual system that contribute to learning. And the impact on learning, you can be skipping or rereading lines, poor comprehension, long time for homework and just exhaustion, and very short attention span. The fact of the matter is there's a lot of misdiagnosis going on because children with vision problems are often diagnosed with ADHD or learning difficulties because they're not learning well. And it's sometimes a lot easier to put them on medication because they're hyperactive. And sometimes, you know, we're not going to the eye doctor. So this is why it's so important to get your eyes checked. And we had discussed this already with the learning disabilities. Now, how do we help our children and kids that are struggling? Well, first of all, we need a proper diagnosis. And we got to figure out, is it the visual acuity? Is it the vision coming into the visual system? Could it actually be that our child is not seeing 20/20? Glasses can fix this, and we'll be discussing myopia later. That is decreasing the visual acuity for our patients in the distance. Now, what I've just been discussing up to now is a lot of binocular vision dysfunction. Could be a combination of eye tracking, eye teaming, eye focusing issues, and this is all captured with a further eye exam. Or is it just a visual perceptual issue? are you having difficulties just processing that information visually? This is a whole other lecture, but there is that component as well. With proper diagnosis, we can have proper treatment. And this is so important. The treatment options are glasses, tints, occlusion filters. We can look at vision therapy for any binocular vision dysfunction. And I would like to kind of lead way into our next topic, and that's really integrated with vision and learning, is myopia. Now, what is myopia? It's when you can't see in the distance. And I'd like to introduce our wonderful speaker from Hoya.
Thank you so much.
Mehran, to join us here.
Appreciate it. Thank you.
And before you get started, I kind of want to go into, how myopia affects learning. Because if I can't see the class or the board, how am I supposed to learn?
Yeah, as you mentioned, 80% of learning is visual. So it is important and it does affect it. So we have some amazing stuff that we're going to go through and talk about how myopia can affect that learning as well.
Definitely. And just simple things like you can't copy the board, you're not seeing the instructions. And in those kind of patients, we're seeing lower confidence as well.
Absolutely.
Right?
Yeah, there's vulnerability with that for sure.
So welcome, and I'll let you take the stage and talk about, our myopia control. Our shared goals between the two of us really is to get our patients to see clearly and enhance their learning as much as possible.
For sure, yeah.
All right, so I'll let you take the stage.
Thank you so much, yeah. Alrighty, thank you so much, Dr. Olga. Appreciate it. I appreciate the chance to talk about myopia and how it affects the vision and learning. My name is Mehran, and I'm a territory sales manager from Hoya Vision Care Canada. So there's a question here: why are these governing bodies so concerned today that they call it an epidemic? They call myopia an epidemic because based on the studies, about 30% of the world's population is myopic today, and it is estimated that by the year 2050, about 50% of the world's population are going to be myopic, which is about more than 5 billion people in the world. So that's why actually they're going further and call it an epidemic. And to reduce the severity of this worldwide problem, it is especially important to offer myopia management solutions early in life, because correcting, protecting, and preserving the eyesight of the future visionaries is of the utmost importance here. So let's see what can cause myopia. Myopia is actually a multifactorial disease, and there are major risk factors for myopia. Some of them are strong and casual factors, including education, time, which is spent outdoors, and some of them are stronger, like the parental myopia. I mean, our lives as adults actually is much more near focused these days. We're using iPads, iPhones, like tablets, laptops all the time. And when it comes to children, it's pretty much the same. They are even more near focus these days, and especially along with their schoolwork. That's why their working distance, their reading distance has been decreased over the past few years. And also, genetics plays a very important role here, along with the parental myopia. Like, it has been proven that if a child's parent is myopic, then the child is 3 times more likely to become myopic. And then if both parents are myopic, then the child is 6 times more likely to become myopic. So if myopia is something which is running in the family, it is important to be proactive when it comes to myopia and monitor it and have those regular eye follow-ups at least every 6 months. So the World Council of Optometry and the Canadian Association of Optometrists have both endorsed the fact that there is no safe level of myopia. And it is a disease, and it should be treated as such because it does pose a health risk. And as you can see, there is no safe level of myopia here. Okay, sorry, I don't know. Yeah. So as can be seen in this chart, okay, there are some ocular complications that can happen to the eye as the, myopia progresses. So we have the myopic maculopathy, we have the retinal detachment, we have the posterior subcapsular cataract and glaucoma, which we're going to talk about them in the next slides, and we're going to. As you can see, one diopter increase in myopia is associated with a 67% increase in myopic maculopathy. And as the eye grows longer, as the myopia progresses to higher degrees, you can see that all these ocular threats and complications actually increase exponentially. So not even a prescription of -1 diopter, okay, can be taken can be ignored because there is no safe level of myopia. Now, here I would like to ask Dr. Korkis to join us and walk us through what those ocular complications are. Thank you so much.
Thank you so much.
Yeah, I appreciate that, Dr. Korkis.
All right, so it's a pleasure to be able to speak on the platform and represent Bayview Vision. So just as we discussed, myopia can be very serious, and unfortunately they can lead to a lot of diseases that us practitioners deal in practice, and we have to sort of address these. So the first and foremost thing that we deal with are retinal detachments. So a retinal detachment can be sight-threatening, not life-threatening, but patients can actually become blind if it's not picked up and we don't address it by referring it to ophthalmology. So the retina separates. So what a retinal detachment is when the retina separates from its supportive tissue, and it's a light-sensitive layer at the back of the eye, which converts the light into its electrical signals that are sent to the brain to create a visual image. So typically when a patient is having signs of retinal detachment, they'll complain of flashing lights. So flashing lights can be like fireworks, lightning bolts, paparazzi flashes, anything that's quite unusual. Floaters, and that can be anything, typically a shower of floaters. Floaters can manifest in different ways, such as worms, bubbles, spiders, spots, that kind of thing. A curtain or veil or a blind coming down is a really good indication that there's some area of the vision that's actually been blocked, and that's very serious. So like I mentioned before, it can cause permanent vision loss. So, after dilating the patient and examining the patient, if we do suspect and we can diagnose that they are having a retinal detachment, whether the macula is on or off, the macula being the area of the central vision, we then refer urgently to ophthalmology, and they address it typically with surgery, and there's different types of surgery. So if it's caught quite early and we're able to get them to the right care, the results are typically very good. Sometimes the vision can't be restored and the quality of the vision may be a little bit distorted, but typically surgeons these days act very fast and we can restore the vision. Myopic maculopathy. So it's a type of eye condition that affects people with severe myopia. So patients that are typically higher than -6, that's considered high myopia. So in this condition, like Dr. Olga mentioned, the elongated shape of the eyeball will be stretched, and as a result, the retina is thinning. And this particularly is affected at the macula, which I mentioned, the central part of the retina. And this is responsible for sharp vision and color. So this thinning can lead to severe damage, bleeding, or scarring in the macula, which may cause distortion or blurry vision. And in severe cases, it can result in severe or significant vision loss. So it is progressive, and it requires regular monitoring and sometimes treatment to manage complications. So this is a little bit more difficult, not as straightforward as a retinal detachment in terms of therapy, but either way, if the vision is deteriorating quite quickly and we're concerned about the rapid vision loss, this is a direct referral to ophthalmology. So cataracts are quite common, especially posterior subcapsular cataract. We call it PSC. So it's a type of cataract that forms at the back of the lens of the eye, just in front of the capsule that holds the lens in place. So this is a pretty common cataract that we see, but patients typically are going to complain of glare, blurriness to bright light, so they can see light scatter, lots of glare. They're going to have issues with sunlight or cars with headlights at night. It also affects our reading vision, and it can develop quite quickly. So patients that notice that the vision is quite down, it's because the cataract, even if it's mild, the way that it's located typically does affect the vision more than the other cataracts like nuclear sclerosis. All right, glaucoma. We hear glaucoma in the media, and there's a lot of talks of glaucoma, considering there's a strong family history component. But high myopia does increase the risk of glaucoma, specifically POAG, which is primary open-angle glaucoma, that us practitioners do regularly treat. So in myopic eyes, which we discussed, the elongated shape causes the structural changes, which can cause thinning of the retina and the optic nerve, which can make the eye more susceptible to damage from the pressure. So as a result, the eye pressure tends to creep up, and that will cause optic nerve damage. Additionally, the anatomical changes in our eyes can lead to more fragile optic nerve head, making it more sort of glaucoma-related damage, even in a normal eye if the eye pressures are normal. So these factors together can raise the likelihood of glaucoma with individuals with high myopia. So again, this is not something to be taken lightly. Screening and regular treatment is often sort of involved when we're seeing these patients. Also with glaucoma, if it's picked up late or if it's mid-end stage, what happens is we start losing our peripheral vision, like it's looking through a tunnel. Unfortunately, glaucoma, we call in optometry, ophthalmology, in the eye world, that it's a silent killer. So it's really important that we get our patients in because unless it's sort of picked up much later, the damage will be permanent, and that's when we start losing our peripheral vision. So again, we don't want this to happen, and we want to educate our patients. So it's really important that we do have regular screening just to make sure if we do pick up glaucoma, we can treat that. Lots of good treatment options these days. Typically, we treat with a drop to lower the eye pressure, 1 drop at bedtime. If it's a bit more aggressive and there's other treatments that need to be involved, like a laser, that's when ophthalmology steps in. Either way, it's something that we treat regularly, and it can be prevented with respect to moderate to severe vision loss. So it's really important that we get our patients in. All right, and that pretty much covers all the serious eye diseases with myopia. So it's good to kind of be up to date on those kind of things.
Yeah.
And who do I want to hand it over? Okay, perfect.
Appreciate it, Dr. Korkis.
Yeah, my pleasure.
It was great. Yeah, those complications seem really scary, and they can happen if the eye grows really, the progression actually is fast and we don't slow it down for the kids. But there's a solution for that, okay, which we're going to talk about it. So what is the immediate risk of myopia, if we do not control it? So think of the impact it can actually have on your lifestyle. Okay, we do have some myopes in this room. So I would like to ask you guys, what is the effect of myopia in your daily lives? How do you think it's affecting your life? For example, imagine when you are driving, you want to see the signs, for example, or makeup could be hard, to apply. The mirror doesn't seem like close enough, Or for example,
see the signs on the road.
Exactly, yeah. Or when you are, for example, taking a shower, or for example, you want to shave, it's going to be really difficult for some people.
Or
Playing
makeup, you can't see anything.
Yeah, exactly. You have to put on your glasses to be able to see even the clock and everything, for sure. Playing sports, and your glasses are all over the place, Some people might say, okay, I'm going to wear contact lenses, but they're not the easiest to wear, okay? And there are some limitations to contact lenses. There are some other side effects, to contact lenses, including the hygienic issues. So there is vulnerability that comes with myopia, with being a myope. And the primary objection is actually, the primary goal here is to offer myopia management and slow down the myopia progression. And this is actually how the kids will see the board. And this is something that they might not talk about. This is something that we need to be proactive. Parents need to be proactive. Parents need to ask questions to make sure if their children are actually able to see the board very clearly. The simulator is showing what happens if the eye prescription changes from plano, 0, without any prescription, all the way to -10. So as you can see, it's very blurry. For those of you who are myopes, what would you give if you could go back in time, and you could wear a solution that your prescription could actually results in, I don't know, minus 1.5 or minus 1.75 rather than being a high myope, like close to minus 5 or minus 6. So it is important to manage myopia. Now, a question could be, who is a candidate for myopia management? A child with family history of myopia. We already talked about the effect of parental myopia. As I said, if a child's parent is myopic, then the child is 3 times more likely. So it could be a candidate for this one. A child who spends more time indoors, focused up close, activities and distances, and all myopic children. Healthy ocular hygiene is also very important. It's a great way to help actually managing myopia. One of the most important things and line of defense would be spending 2 or more hours outdoors. This is something that a lot of doctors would recommend to myopic children, ask the patients to spend at least 2 hours outdoors because it is believed that it can delay the age of onset for myopia. Employing the 20-20-20 rule can be another effective way to delay the onset of myopia, which is every 20 minutes, spend 20 seconds looking at objects 20 feet afar. That can also help. Increasing the reading distance or hold reading materials at a further focal length is something that actually children can do in order to slow down the myopia progression. Annual eye exams is very important. Actually, it is great. I mean, it would be even better to have these eye exams at least every 6 months, to make sure that the eye is okay, the prescription is not changing. And if the prescription is changing, bringing in other modalities of myopia management as well. And myopia management follow-up visits is also another habit that can be implemented in the lifestyle to make sure that the prescribed modality is working and to make sure that the treatment goals are achieved. So early intervention is very important here. So kids' eyes grow and change quickly, especially, and normally, the myopia would emerge at the age of 7, and it progresses very fast until the age of 11. And as can be seen here, towards those ages from 7 to 11, you would see that we have a lot of low myopic and high myopic kids compared to later ages. So that early intervention is very important here, and it shows the importance of being proactive and choosing evidence-based myopia solutions as well. Now, I would like to talk about MyoSmart, which is the safest, the most effective, and a non-invasive solution when it comes to myopia management. So let's see what MyoSmart is and how it works. So what you see here is uncorrected myopia on the left. So with a myopic eye, what ends up happening is those light rays focusing in front of the retina, and particularly in the very peripheries behind the retina. So that's why the patient won't be able to see the distance. With the traditional single vision correction, what happens though is those central vision, focal points are formed on the surface of the retina. However, the majority of those rays are focusing behind the retina, which creates hyperopic defocus. And the eye is going to react to this by becoming longer. And when the eye becomes longer, it means myopia is progressing. Whereas when it comes to the ideal correction, which actually is the technology we use in MyoSmart lenses, we can see that it creates myopic defocus, which slows down the myopia progression. So this is how the lens actually works. As I said, the technology that we use is the revolutionary DEAMS technology, defocus incorporated multiple segments technology. There is a carrier to the lens, which is the entire lens surface with the distance correction. So we have the distance correction in that carrier part of the lens. And then in the center of the lens, with a diameter of 9.4 millimeter, we have the distance correction as well. And then we have the defocus zone surrounding actually 33 millimeter honeycomb structure to manage myopia progression. So each little island, as you can see here, comes with a plus of 3.5 hour. And we use a high density honeycomb structure. Actually, there are 396 defocus islands, which are distributed evenly for consistent treatment. And there is a balanced 50-50 ratio of focus and defocus at the same time. And this is actually what has been proven to be effective in slowing down the myopia progression. Clinical studies are the foundation of a treatment solution. And when it comes to MyoSmart, it's backed by 8 years of proven clinical study. Actually, it has the longest clinical study among any other myopia modality. So there is robust evidence with over 90 publications, which provides confidence when choosing a myopia treatment. So it's widely accepted myopia control theory, which is endorsed by the leading researchers, such as the peripheral hyperopic defocus theory. Cost effectiveness is validated versus the World Health Organization or WHO standards. The proven performance evidence showing high efficacy, long-term sustained treatment effect, and no rebound effect. This is also important to know. Even if the child stops to wear MyoSmart lenses, there is not going to be a rebound effect. And overall, effect on the quality of life and tolerability is also another benefit of the MyoSmart lenses. And treatment has been studied among different ethnicities, not just among Asian children, but also among Caucasian children, and the results have been pretty much the same. So it shows, the results are sustained. And its endorsement, which is actually, it's endorsed by peers and health authorities and other factors. So we have, as I said, 8 years of clinical study, which also shows the result among those children between the ages of 16 to 21-year-olds, those children who continuously wore MyoSmart lenses over 8 years, which showed a slowdown of myopia and a general progression of less than half a diopter. The results have been amazing with these lenses. It's safe, non-invasive solution with easy adaptation. It's really easy to use. There is no concerns like in regards of adaptation or how to use these lenses. And the sustained treatment effects over 8 years. And this is just a comparison between those children who continuously wore MyoSmart lenses for 6 years and children who wore single vision lenses for 2 years. So those children, after 2 years, ended up in a prescription that children wearing MyoSmart lenses actually ended after 6 years. So that shows the efficacy, how it slows down the progression. So conclusions from the studies, as I said, 8 years of clinical study. It is the longest running myopia control spectacle lens study, sustained over 8 years. Average progression is less than half a diopter over 8 years. And it restored actually a metropic, which is the normal eye growth, which is averaging 0.1 millimeter per year. And there is no rebound effect. This is also very important. Now, as I said, for myopia management, prevention is key. And that's why a lot of doctors ask their patients to spend a minimum of 2 hours outdoors every day. But then there is the exposure to the UV. And we still need to protect the eyes from the UV. And the more time a child spends in any given treatment, the better the results are going to be. So that's why if children switch to normal single vision lenses with any polarized or let's say tint options, they're actually interrupting the treatment. So that's why we have a solution here, which is the MyoSmart Chameleon which is the light reactive technology we offer with this myopia control lens. And we have taken into account the kids' lifestyles as well, because they need a swift performance. And that's what MyoSmart Chameleon would offer. So when they're indoors, there's actually about 5% residual tint compared to the clear one, okay, which is at 3%. So you would barely see any residual tint in this lens. And when they are activated, they're actually, they come to the sun category 2 by 78% density. And fading back is also very swift with this MyoSmart Chameleon lenses. In a minute or so, it fades back to its clear state. And just for your reference, it's only available in gray color. It's not available in brown.
Not yet.
Not yet, yeah. Because the studies are based on the gray color for now, and there's no study on the brown filter. So the expert consensus is that outdoor time is the key for the prevention of onset, and it's recommended to be outdoors for more than 80 minutes a day. Treatment should be worn for at least 12 hours a day, and the longer the treatment is worn, the better the results they're going to get. So it's going to result in more efficacy. And we also know that intense light can cause glare, and it can also reduce the visual performance for children. So it can also be one of the side effects with other myopia management modalities, including atropine. So that's why the MyoSmart Chameleon could be a perfect complement to that. And finally, MyoSmart Chameleon provides an all-in-one solution for safe, effective, and non-invasive myopia management. So even when they are outdoors, their eyes are both treated and protected from the harmful UV rays at the same time. Now, a question could be, why investing in myopia management? What are the benefits of myopia management? So this is what actually myopia management and the investment by families could deliver. There's going to be less time with blurry vision between eye exams, which can help slowing down that progression. There is going to be improved corrective surgical outcomes in the future. So if the child wants to get any corrective surgery, including LASIK, or other types of corrective surgeries in the future, the chances are going to be better. There's a lifetime cost saving. So we had actually a lens here. This is actually what can end up happening to the lenses if the eye progresses really high. This is what's the prescription with this one? Is it the minus 21? Yeah, you see how the lens will be thick, how thick the lens could be. So we can actually save some costs by not going with these high indices. As the myopia slows down, okay, we can go with simple indices, so it can save a lot of costs for families as well. And the freedom from dependence on eyewear, for sure, that's another benefit of investment on myopia management. And it also reduces the risk of eye diseases associated with blindness that Dr. Korkis walked us through that. And in general, it offers better quality of life. So MyoSmart is the smartest way to manage myopia in children. And it is important to choose treatments to slow the progression of myopia in children based on the best evidence available. And that's what MyoSmart lenses offer, backed by 8 years of clinical studies. That's pretty much everything I wanted to talk about. Now I would like to ask Dr. Olga to continue this presentation and walk us through myopia control and other modalities. Thank you so much.
Thank you.
Appreciate it.
Thank you, Mehran, for sharing the MyoSmart lenses. And they're amazing. My patients love them, and we've been using them for years. And you can't even tell. You can't even tell. It's like a beehive effect. And I cannot tell you the numbers of patients that I have had in the past, when did we start doing these?
It's been like about 5 years now.
Yeah, I'd say 5 years or so. There's very minimal progression or no progression, and it's phenomenal. And we've had such great success. We can't forget that myopia control, this is one way. The MyoSmart lens is one way, and it's a fantastic one, especially for our young children. It's nice and easy. You just put it in a lens glasses, right? It's great. And there's no aesthetic. It looks like a normal lens, which is nice. But there's also specialty contact lenses. We can look at soft contact lenses. We can do orthokeratometry, where you are sleeping with the lenses at night as well. So it's called ortho-K. We can do a pharmaceutical approach, where we do a low dose atropine, and that's usually done in conjunction. And absolutely, the lifestyle changes, like Mehran was discussing, a lot more outdoor time. So there's a lot of myopia control options, but this all brings us back to what we want for our children is we want their vision to be clear. When vision is clear and focused, learning thrives. It's that simple. If I can see the board, if I can see what I'm reading, if I can see my teacher, I'm going to learn better, and it'll be much easier. So whether it's because our children have myopia or they are not having good eye teaming because they have a binocular vision issue, we want to make sure that the vision is clear. And a really big take-home point today, and what I want all of you guys to go home with, is our parents and our teachers. Watch for signs and struggles of our children. Like I said from the beginning, our children do not want to be bringing home bad marks. They don't want to be having difficulty learning. They don't want to be failing school. They want to excel. So watch for signs and struggles. To our community, advocate, for functional eye exams, for vision eye exams, regular eye exams. Make sure everyone is educated to come in and get an eye exam. And in Ontario, OHIP covers eye exams for all children 19 and under every single year. So there are absolutely no excuses for that. And our children, they deserve clarity and good learning support, right? And sometimes they don't know what they don't know. They don't know that it can be clearer. Things shouldn't be ghosting. Things shouldn't be blurry when I look in the distance. So I just really want everyone to take that home today. And thank you so much for joining us this evening. It means the world to share our learnings, the connection between vision and learning, and what we can do for myopia and what myopia is. So together, we can protect vision and unlock learning potential for all our children. So thank you.
Thank you.